Hello everyone and welcome back to our channel GDC Classes English. So today we are going to deal with our 33rd lecture of Daily Pharma Dose session that is equally important for each and every pharma aspirants preparing for GPAT, NIPER, DI as well as pharmacist examinations, and many vacancies are lined up for you guys. So this is the best opportunity and the best platform to make your practice strong and strongest. So let's start our session with the first question. The correct order of bioavailability is, this is the previous year question from NIPER JE 2023. Okay, so no doubt it is said that parenteral has the highest bioavailability, 100% bioavailability, because it is directly released into our systemic circulation. So parenteral is the first choice obviously. Next we have our oral. So oral has the more chances as compared to the rectal, because all these two options are now cancelled. Also we can go with 3, but then only rectal has the 50% of bioavailability and also depends on the situation of a particular person. So according to our comparison, if we do the comparison, then rectal and in oral condition, the oral has the higher bioavailability, and also yes, so our option second will be oral. Then according to this will be the correct answer. Next we have our rectal, and the last is known as the topical. Why topical is last? Because the absorption depends on the skin type and the layers. It has the very slow absorption, hence very low bioavailability. Only lipid soluble drugs can give maximum bioavailability. So correct answer will be option number C. Okay, now second question. Potash alum is used as an, this is the previous year question from MPPGCL Pharmacist 2024. So what is an alum? Alum is a type of acidic agent, or we can say alum has a acidic in nature and cannot work as an antacids, because meaning of antacids is to suppress the acids, and it itself has the acidic nature. So obviously they are not a type of antacids. Next we have acidifying agent. So acidifying agents, alum can acidify, but it is not used in pharmacological purpose. Okay. Next we have astringent. So yes, alum has the astringent property, as alum contracts the proteins and also helps in reducing the bleeding. Whenever we cause after shaving, there we have little amount of cut, then we used to rub alum to stop the bleeding. Clear? As the protein coagulates or contracts. Okay. It is also used in our gargles. Next we have antidote. So alums have never the antidote action. Okay. Clear? Now the next question. Which of the following are the accessory organs of the digestive system? Okay, fine. Accessory organs, not the main organs. Our digestive system starts from our mouth, then we have our teeth, tongue, next is our buccal region, we have the pharynx, we have the esophagus, we have the stomach, we have the intestines. Clear? So these are known as the main organs of digestive system, but it's talking about our accessory organs. So accessory organs are known as the supportive organs, and examples of accessory organs are liver, pancreas and gallbladder. They play an important role sideways to help our digestion process. As liver produces bile, helps in digestion of fats, pancreas produces insulin, glucagon, somatostatin, which somatostatin inhibits the acid secretion, gastric acid secretion. Next we have gallbladder, it stores the bile. Clear? So all of them are the accessory organs except for small intestine. So option number 2, 3, 4 are correct. So option number D will be the correct answer, that is 2, 3 and 4. Okay. Now the next question. About of the total calcium present in human body is in the blood. Okay. This is the previous year question from Railway Pharmacy 2015. In a human body, we have the 99% of calcium present in our bones. Also, they help in making our bones or giving our bones a particular strength, and also they are present in teeth with combination with phosphates. Okay, clear? So the 1% of your total calcium is present in your blood, is present in your muscles, and is present in your other tissues, and helps in clotting, nerve transmission, as well as muscle contraction. Clear? Now, the next question. Traditional medicine means, okay, obviously traditional medicines means that are formed from the traditional or cultural root. They doesn't contain any synthetic polymers. Clear? So see, used recently after experimental proof. So this is not a traditional medicine. This is known as the new evidence-based medicine that is launched after the trials. Clear? Next, we have used on the basis of practice and cultural activities. So yes, our culture, in this we represent our culture, we represent our tradition that has been set after the many basis of practices. So yes, option number B will be correct. A and B are obviously incorrect because A is not a traditional medicine. Use of synthesized drug. The name itself says the synthesized drug. That means that contains the chemically made drugs. So obviously this is wrong. Then the option will be option number B, which is correct. Okay, clear? Now the next question, which says indicate the agent of choice in the emergency therapy of anaphylactic shock. This is the previous year question from DSSB 2015. Okay, so what is an anaphylactic shock? It is a type of severe allergic condition or reaction in which your airways closes, your BP drops, and you have a huge bronchospasm as well as swelling. Clear? Okay, so these are the symptoms of your anaphylactic shock, we can say. Now, first drug we have methozamine. So methozamine is what? These drugs are used as the pure alpha-1 agonist, and alpha-1, the one represents your what? Obviously you all know that is in your blood vessels, we can say in heart. It is present in heart. So it causes vasoconstriction. So we need the drug that causes vasodilation, not vasoconstriction. Yes, in case of BP we can say this is used, but not in all conditions of your anaphylactic shock. Clear? Next we have terbutaline. Yes, terbutaline. This is a type of beta-2 agonist. Beta-2 means 2. That 2 lungs are there in our body. That means beta-2 receptors are present in our lungs. So yes, we can say this beta-2 has the bronchodilation action and opens the airway. So they both given singly can be good, but we need to find a drug that is equally important for each and every conditions of anaphylactic shock. So next we have norepinephrine. So norepinephrine is a type of alpha-1 as well as weak beta-2. Clear? They have strong alpha-1 action and weak beta-2 action. So this will also be not the correct answer. Next we have epinephrine. So yes, this is correct because it shows it acts on alpha-1, beta-1 as well as beta-2 receptors. While acting on alpha-1 receptors, it shows the vasoconstriction. It helps in increasing the blood pressure. While acting on beta-1, it increases the heart rate and increases the cardiac output. While acting on beta-2, it causes the bronchodilation and open up the swollen airways. Clear? So yes, option number D will be the correct answer. Okay. Now the next question. The shotgun sequencing is used for the sequencing of, okay, shotgun. By using a gun, I think you can make you can break some pieces. So obviously we can say for small DNA molecules, already the DNA is small in nature, then how can a gun break it? I am just giving you a logical reason. Okay, so this is the wrong answer. Next we have also, what is a shotgun sequencing method? Just understand it. Shotgun is used when DNA is too large to break the sequences and then rearrange it in a correct pattern is your shotgun sequencing method. Clear? They randomly break the DNA in small fragments as well as they rearrange, sequence the small fragments, and also they use computers to assemble the full DNA sequence. This is the perfect, they gives the perfect whole genomes. That is Human Genome Project. Clear? So yes, we can say large DNA molecules are braked by using shotgun sequencing method. Clear? Here we have the RNA. So RNA has no role in our this particular method. Okay. Now, question number 8. In a multiprocessor system where each multiple processor have their own local caches, which is the main challenge that needs to be addressed to ensure data consistency. Okay, fine. What is this? What is this? So first option we have cache replacement. First of all, understand the question. It is a type of multiprocessor system where each multiple processor have their own local caches. The main challenge needs to be addressed to ensure data consistency. That means each and every cache should be assembled together so that the data can be read properly. This is the main thing, main point of the question. So first we have cache replacement. So obviously this is wrong, because in this, while choosing this, we can say the data can be removed and add from the cache. The replacement is going on, but we need to address the consistency. We need to keep all the data together. Next we have cache partitioning. What is this? This is dividing the cache among the partitions. So obviously this is also wrong. Next we have cache concurrence. What is this? Keeping the data consistent together across the multiple caches is known as your cache concurrence. Clear? So this is the correct answer. And next we have cache latency. So we can understand this. Cache latency is the we can say delay in our increasing cache. Clear? Okay, fine. See, you can have a look over this explanation and each and everything will be cleared. Now the next question. 25 people working 10 hours a day can complete 2 units of work in 6 days. How many days are required by 10 persons to complete the 16 unit of work working 8 hours a day? Okay, first of all, we need to find out, or we need to calculate the total amount of work as well as the people. So how we will calculate? So we have 25 people. That is, they are working 10 days, we can say 10 hours. So that is 10 hours per day. Next we have to complete 2 units in 6 days. So yes, we can say 2 units in 6 days, and they took 6 days to complete 2 units of work. So this is our equation, okay, equals to 2 units of work. This is the equation. Now solve the equation to get the further process. So 25 multiplied by 10 multiplied by 6. Once you will do the calculation, you will get the value of 1500 hours per day, or we can say person hours per day. Clear? Man hours per day. Clear? So this will be the correct equation for this. Now we will find, because we need to find about the 16. So according how do we solve the question? First of all, we need to take out the value of one unit. So how you will find the value of 1 unit? That is 1500 divided by 2, obviously. Yes, definitely we need to find, we will divide, this is 2 unit, okay. So now we will find the value of 1 unit. So 1500 divided by 2, you will get what? Just solve it, and I think you will get the value of 750. Fine. You will get the value of 750 man hours, or we can say days. Clear? So this is the value for one unit, this is the value for second unit. Now we need to find out the value, or we can say for 16 units. So how will you find out the value for 16? Obviously we will do the multiplication. For 16 units we will multiply 750 into 16, and I think you will get the value of 1200 or 12,000. Yes, obviously this is 12,000. Yes, correct. You will get the value of 12,000 man hours. Now find, now the second step is we need to find how many days 10 people will need to complete the work, that is 8 hours per day. Clear? So this is our second thing. So how we will calculate work done per day by 10 people. So what is the work done by 10 people? So 10 persons into, we will have in how many hours they do, that is in 8 hours. So 10 into 8 hours is equal to 800 hours per day. Clear? 800 are man hours per day. This is required for 10 people will take. Now how many days are required? So how you will find out it? So about what is the value of 16 units? So value is 12,000. So 12,000 divided by how many men you need to go with it? That is 80. Yes? Okay, this is not 800, this is 80. So this will be the answer. Just divide it and you will get the value of 150 days. So 150 days you will take to complete the work. Okay? Fine. To complete 16 unit of work, 8 hours per day by 10 persons. Clear? Okay? This is a little bit critical solution. So you can have a screenshot of this particular and you will get a clear view. Okay? Now, the next question. Virus which is responsible for HIV belongs to which of the following family? Okay, fine. First we have Hypoviridae. What is Hypoviridae? They actually infects the fungi, and HIV is a type of virus, not a type of fungi, so it is not related to your HIV. Next we have a DNA virus, Cytoviridae. So yes, we can say it is a type of virus, but it is used in segmented double-stranded RNA virus. This is a type of segmented double-stranded RNA virus. Clear? And they infects the bacteria. So no, this is not the correct answer. Next we have the Retroviridae. So this is the correct answer. This is a type of RNA virus with reverse transcriptase. That means they will create RNA from DNA. So and hence HIV belongs to this particular family. Next we have our Totiviridae. This Totiviridae is also a type of double-stranded RNA virus and infects the fungi as well as protozoa. So correct answer is option number C. Okay. So these were today's 10 questions. I hope you enjoyed the session. If you have any doubt, comment me in the comment section and go with the explanations again. If you have any doubt, just you can move on the video some minutes and you can see the explanation of those parts. Okay. So we will meet in the next session with the next new questions. All the very best.